thyroid gland. And here we have adrenal gland or suprarenal gland. This is testis. Here is ovary. This is ovary. Pancreas. And these are parathyroid glands. This is posterior view. Parathyroid glands, four superior parathyroid glands and inferior parathyroid glands. So these are endocrine glands. Again, pituitary gland, you know theory about it, where it is located, insula turcica. You know this thyroid gland in the middle of front of neck. And here is adrenal gland on the upper pole of the kidneys, and testis in the scrotum, and ovaries in the pelvis. You have pancreas, and these are parathyroid glands, four parathyroid glands. So here are endocrine glands. You can see ovaries here. This is uterus, tubes, and these are ovaries, yellow one. These are ovaries. These are tubes, fallopian tubes or uterine tubes. Now temporal and infratemporal fossa. This is temporal fossa. This space above the zygomatic arch. This space is temporal fossa. Above the zygomatic arch, this space is temporal fossa. In the floor of the temporal fossa, you can see H-shaped suture and pteriode. This is pteriode, is the junction of H-shaped suture in the floor of temporal fossa. These are temporal lines. This is zygomatic arch. And this space below the zygomatic arch is infratemporal fossa. This is infratemporal fossa. You know, roof lateral part is gap deep to the zygomatic arch, and medial part is, this is infratemporal surface of greater wing of sphenoid bone. You can see this anterior wall. This is posterior surface of body of maxilla. So this is this space, and medial wall is formed by the lateral pterygoid. This is lateral pterygoid plate. So this is infratemporal fossa, and this is temporal fossa. This is gap deep to the zygomatic arch. This gap deep to the zygomatic arch communicates the temporal fossa with infratemporal fossa. And tendon of temporalis, deep temporal nerve, and deep temporal vessels passes through it. So this is clear. Temporal fossa and infratemporal fossa and endocrine glands. Where is TM joint?